Hello, everyone. Welcome to Healthy Living Together. I am 𝗠𝗀𝗴𝗻𝘀cie. I am from the Sanilac County Health Department, and I'm going to just go through a couple of housekeeping items with you. Just so you know, your audio is automatically muted. And if you have any questions throughout the presentation, please utilize the Q&A function. It's at the bottom of the screen, and I will be monitoring that, and we will make space at the end of the presentation to go through any questions that have been submitted. We will go ahead and get started. Megan Mason is here presenting today. She is presenting on breastfeeding, newborn care, and postpartum care. So you can go ahead and start your presentation when you're ready, Megan.
All right, thanks, Katie. Let me just get this pulled up. Okay, does that look good? Okay, so as Katie said, I'm Megan Mason. I am an RN with the Sanilac County Health Department. I've been working here in public health for about 8 years total. I did take some time off to be a stay-at-home mom in between. And then prior to this, I worked in a labor and delivery unit in Cadillac at Mercy Hospital for a couple years. Currently, I'm working on getting my Lamaze certification, and then I also hold a certification as a breastfeeding specialist as well. And then this is my family. That's me and my son up there on the left, and then my daughter on the bottom. And then my husband and my kids now up on the top. So I've been through all the stuff that we're going to talk about today personally as well. So I'm going to start with breastfeeding because breastfeeding really starts before you deliver the baby. And by that, I mean, breastfeeding doesn't come just naturally. And it can be very frustrating for some moms at first, especially those first few days. So one of the greatest predictors of being successful with breastfeeding is having a great support person. Um, so it's really important for a mom to find somebody that's going to advocate for her and to be supportive of the whole breastfeeding process. Without that support, it can get really sticky. So of course, why do we want to breastfeed? Well, there's a couple reasons for the babies and a couple reasons for the moms. But for babies, the overall health benefit is substantial. There's less risk for ear infections, colds or upper respiratory infections, decreased risk for SIDS or sudden infant death syndrome, less risk for childhood and adult diabetes, obesity, different cancers, and different allergies. And then for moms, there is a decreased risk for different cancers, including breast cancer, ovarian cancer. It can help the postpartum healing, less chance of postpartum depression, less chance of heart disease, and also you burn a little bit of extra calories when you breastfeed. So I always tell my mamas to go ahead and eat that slice of cake. Breast milk is really cool because it's a living entity. So there's this really neat thing that happens. There's what we call a saliva transfer, where when the infant is actually nursing at the breast, it sends a message to mom's body about what that infant may need. So if a baby comes down with a cold, it says, "Hey, mom, have you ever had this cold before?" And mom's body says, "Why, yes, I have. And I have some antibodies that I'm going to give you." And so the breast milk starts ramping up those antibodies and passes those back to the infant to help them overcome that illness quicker. So you can see the breast milk here on the picture on the left is a lot lighter, and then the one on the right has changed in color, and that's in a response to the infant actually being sick. So what you need for breastfeeding, nothing. You really don't. You just need your baby and yourself. But there can be some things that make it a little easier, such as comfortable chairs, milk storage bags if you plan to pump, a good pump, and of course, pump cleaning supplies. And of course, the one thing that is kind of necessary is nursing pads, and you can get disposable ones or reusable ones. Moms in general will leak. Some moms get lucky and that doesn't happen, but sometimes you do. Other things, lanolin. Sometimes we have some damage to the nipple area, and lanolin can be a nice protective coating. But if you don't have that, you can always use stuff like coconut oil or olive oil as well. So after you deliver your infant, we have what we call the golden hour, and really it's more like the golden 2 hours. And this begins right after the baby's born. Um, this is a critical time of bonding between the infant and the mom. And what I recommend is that the baby be placed directly on the mom's tummy right after birth, as long as this is medically okay. There's no reason to take the baby from mom, and they should be put right on mom's tummy. And infants are born with a whole bunch of reflexes that actually allow them to start breastfeeding on their own. It's really cool. They have the stepping reflex, they have the rooting reflex, the sucking reflex, and all of those work together to actually initiate breastfeeding, and then without the help of the mom. There is a video that you can watch, and I have it, but I'm not going to stream it because of my connection. But if interested, I can always get you a link. But the baby will actually crawl up to the breast and find the nipple and start nursing all on their own without being touched. One of the interesting things about the breast is there are some glands, or they look like little bumps that surround the nipple, and they're called Montgomery glands. And they're actually finding that these secrete a smell that smells like the amniotic fluid, so babies are able to sniff that out. So during the golden hour, babies go through these stages. They can even go back and forth. They follow this pretty much to the T. They have the birth cry, and then they relax. And then they kind of become awake, and they look around, and they're just taking everything in. And then they become, they go through the activity phase, and they're using big motor movements. And then they can rest, and then they can do some more activity. It goes back and forth. But eventually they will go to the crawling and the familiarization and the sucking stage, which is what I just kind of talked about. But yeah, they'll use their stepping reflex to push themselves up mommy's tummy, the rooting reflex to kind of bop around and find the breast, and then the sucking reflex to actually suck and drink milk once they find the breast. So in addition to being able to crawl up to the breast, putting the baby on mom's abdomen after birth provides the benefit of skin to skin. Skin to skin can help regulate the infant's body temperature, and much better than an infant warmer. It can increase the oxytocin levels in the mom, which oxytocin is the love hormone. It makes everything happen, and it stimulates your contractions, it stimulates milk letdown, and it makes you feel nice and relaxed sometimes too. That in combination with the prolactin. Skin to skin right after birth has shown to increase the duration of breastfeeding overall, and then it can also reduce the risk for uterine hemorrhage in the mother. Something to keep in mind though when you're breastfeeding is the amount of milk that you're going to produce is going to be very, very small at first. You're probably not going to be able to use a pump to get anything out, and that's completely normal. An infant's belly is only the size of a cherry, or about 1 teaspoon on the day that they're born. And gradually it will increase in size, and they'll be able to take in more milk, but it's very, very small. So the first milk that you make, sometimes you can start producing this before delivery, but after delivery, the first milk that you make will be what we call colostrum. It is really thick, it's really sticky, it's a dark yellow color, and it's really hard to express out of the breast. And I always tell mamas the best pump you can ever have is actually your baby. So colostrum's really, really neat as well. It's filled with sugar, with protein, with antibodies, and it helps to act as a laxative. If you've ever seen a newborn's poop, it's really dark and black, and it looks like tar, and it's hard to clean up. So the colostrum actually helps to prime the baby's guts and intestines and get that moving and get that flushed out of their system. They're actually finding out with colostrum, they think that one of the reasons that it is so sticky and thick is to help prevent choking in a newborn. If you ever have a patient that needs that is at risk for aspiration or inhaling their food, they will recommend a nectar or honey thick diet because it's easier for them to swallow. And so, as a newborn is learning to drink and suck, it is possible that this is thick on purpose. Um, so just a neat image. This shows on the left the image of formula under a microscope versus breast milk under a microscope, which has lots of fat globules and lots of white blood cells, which are the like antibodies that help protect your baby from infection. So sometimes the infant does not do the breast crawl. Things don't work out always that way. There's a lot of things that happen during birth that can affect breastfeeding and that first couple hours. Um, it's common and very normal for infants that are born through a C-section or for infants that were born with moms that use epidurals or some kind of pain medications to take a little bit longer to initiate the breastfeeding process, and that's okay. Um, what I recommend is that milk be removed from the breast somehow in the first hour or two after birth. And this shows also an increase in successful breastfeeding duration if that milk is removed right away. So if the baby can't get up to the breast and nurse within the first hour, there's a lot of things that moms can do and partners can remember to remind mom to do because that first hour is kind of a blur. But we can do some, nope, sorry, we can do some hand expression or we can use a pump, but I always recommend the hand expression, which is using your hand to express milk out, and you can put it right into a spoon or a syringe. And I think I talk about that in a little bit here. But that milk removal in the first hour is really important. One of the most important things to removing milk from the breast is to make sure your baby is getting latched on properly. And a good latch should be what we call asymmetrical. So if you look at the picture on the bottom, you don't want your baby latched right onto the nipple. You want them latched onto as much of the breast and areola as possible. And more of the bottom part of the areola should be in the mouth as opposed to the top. This allows them to use their tongue to kind of massage the tissue and bring the nipple towards, you want it towards the back of their mouth, towards the soft palate, and that massages the breast and gets the milk out that way. The lips should be flanged outward. They should not be tucked in. And the baby's mouth should be open as wide as possible. Yeah, never let the baby just suck on the nipple. That will lead to immediately stopping breastfeeding. It's painful. And you can see in this picture is really good demonstration of how those lips should be nice, open and wide. The mouth is open wide, and you can see where the baby is latched on improperly here in the bottom picture as well. Lots of different positions can help you achieve a good latch. For a newborn, I always recommend a cross cradle position or a football hold because you can have more control over the baby's head. As newborns can't control their head movements very well, it's important to be able to support the head and also be able to hold the breast. So the cross cradle, you can see where she's got her hand on the back of the infant's head and she can hold her breast in the other. And then the football hold, she can reach up and support the infant's head and then hold her breast with the other hand there. As the baby gets older, those other positions are great. Laid back is a great position too, especially if you've had a C-section, and that kind of uses gravity to help baby stay latched on the breast as well. Babies will show you that they're hungry and they will start this right when they're born. That rooting reflex or opening their mouth, turning their head, trying to get something, putting their hands to their mouths, is really obvious when you see it after you've been introduced to them. Those early cues are the mouth opening, turning and looking for something to put in their mouth. When they're getting really hungry, they start doing more full body movements, stretching, putting their hands in their mouth. And the late cues are actually when they're crying. So when you're got a hungry baby that's crying, you're to the late point. And sometimes it's hard to get that baby calmed down enough to get them latched on. So learning these hunger cues is really important. So a nursing session should sound and look like They should be latched on properly, like we talked about. They're not going to sit there and suck continuously. They have to take breaks. They need to catch their breath. That's completely normal. And um, you should hear swallowing every 2 to 3 sucks, and you should be able to hear swallowing. If you don't hear swallowing, that could indicate an issue. Now, it also says there should be little to no pain. Yes and no. Most people do not have their nipples sucked on all day, every day. So starting nursing is it can be a little intense, and that's why I recommend the lanolin or the olive oil. So there may be some uncomfortableness, and that should go away within the first couple weeks. But in no means should this be some toe curling pain where you just can't stand it. Then we know we probably have a bad latch. A lot of women say, I didn't make enough to feed my baby, so I had to stop. So again, back to that belly size, it's so small, you don't have to make enough. And you can't make that much because you're going to overfill your baby and they're going to puke it back up. That's a whole other discussion. But that is one of the most common reasons that I hear that women stop breastfeeding is because they felt they didn't have enough milk. A breastfed baby will generally never ever take more than 4 to 6 ounces at a time, and that's from a pumped bottle. Um, I think that's very discouraging for some women that they can't see how much milk that their infant is getting. So the best way to make sure that your baby is getting enough milk is that they are gaining weight after 2 weeks of past birth. And you should never ever compare breastfeeding your milk production to that of another mom's. It's formulated just for your baby, so yours is going to be different than your friends. Other things to look at too is just to make sure baby is having enough wet and dirty diapers. They should have at least one dirty diaper a day, and then 6 to 7 wet ones once they get to like 3 to 4 days of age. So on the weight gain note, babies can lose a bunch of weight after they're born, and we consider it safe for them to lose up to about 10% of their birth weight. Babies take on a lot of fluid during pregnancy and during labor, especially if mom has been induced and they're being given Pitocin, which actually makes you retain fluid. Or if you've had a C-section, they will load you with fluids to help with that blood loss during your surgery. So after birth, a mom urinates and they sweat a lot. Your baby has to do the same thing because they take on those fluids too. So that's completely normal for an infant to lose some weight. So that birth weight that they take is probably not entirely accurate. It's probably more accurate around 24 hours. So don't be alarmed if your baby does lose some weight. That's perfectly normal and acceptable up to that 10%. We want them to be gaining weight back up to birth weight by 2 weeks of age. And after that, they should be gaining 4 to 7 ounces a week. Back to that hand expression that I talked about earlier, this is kind of how you do it. You put your hand around the breast in a C shape, and you're going to push back towards the chest wall and then squeeze outward. It can take a little bit of stimulation to get your milk to let down, but this is a really super effective way to get milk-like colostrum out. And then I don't recommend putting into a bottle because there's just not a lot there. And plus, we don't want the infant using a bottle quite yet. They can get used to that fast flow of a bottle and not like to work at getting the milk out of the breast. So we'd like to avoid the bottle completely. But you can use a spoon or a cup like in these pictures, and your infant will stick their tongue out and lap it up like a little kitty, like you see down in that picture right there. And notice the amount in that spoon. That's completely normal. We don't expect anything more than that. Again, try to avoid all bottles, especially the first few weeks. We have to show infants how to suck at the breast, and introducing that bottle kind of shows them that it's way easier to get that milk out of the bottle. It just kind of flows into their mouth. It's really a drink or drown situation with the bottle. Whereas with the breast, they have to stimulate and work on, the positioning of the breast. It's a whole different way to go about it. Anyway, if you do have to use a bottle for something, we recommend doing pace bottle feeding, and that's basically holding your bottle parallel with the ground or perpendicular to your baby's mouth to keep the milk about halfway up in the nipple, so that they have to actually kind of work at sucking the milk out of the bottle, as opposed to that standard way of feeding an infant where you're kind of pouring the milk down the infant's mouth. And this just kind of keeps them more familiar with how to suck out of the breast as well. The best way to increase your milk supply is to nurse. It is essentially a supply and demand. Um, the used to recommend that you drink lots of water, and we recommend just drinking to your thirst. And usually when you sit down to nurse, you're going to become pretty thirsty. So if you overhydrate, that can actually decrease your production. Lots of things can get in the way of breastfeeding. If your baby's born early, they like to be kind of sleepy. If they have a tongue tie, if there's any structural issues with the mouth, if mom does have inadequate breast tissue or mom has hormonal conditions, um, if baby's circumcised, that can affect nursing, but usually just for a day or so. If baby's had some suction of the oral cavity after birth, it can create an oral aversion, lots of different things. But we have ways to cope with this and tools to help with all of this. So just a plug for the health department. We do have breastfeeding support here for all women. There's no qualifications to get your support. Okay, jumping into postpartum care. Postpartum care begins right after the delivery of the placenta, and um, your placenta can be manually, the doctor can help manually deliver that, or it might take up to like 30 minutes to an hour to deliver that. But right away, the uterus starts to contract. It needs to return to its pre-pregnant size. So your healthcare staff is going to check your what we call the fundal height or the top of the uterus. It's not a great, I don't know, I have a spelling error there, but anyway, it's not a great feeling. They're going to kind of support the uterus from underneath and they're going to come and rub the top and just make sure that the uterus is nice and firm. If it is not firm, they're going to give it a nice massage to help it contract. We want it to contract because there's a big wound in your uterus after you deliver the placenta. And actually, when I do childbirth ed, I hold up a paper plate and say, this is about the size of the wound. And we can't see it on the outside, but we have to remember that we are healing on the inside. So the tighter we can get the uterus clamped, the less bleeding from that wound we have. And it can prevent hemorrhage in the postpartum woman. So generally, each day, the uterus height or that fundal height, the top of the uterus should shrink about 1 centimeter below the belly button. And you will notice some mild cramping throughout the first week or two after you deliver. It can be like menstrual cramping. With each baby that you have, though, those pains can be a little bit stronger, and you will definitely feel them when you're breastfeeding, because breastfeeding again releases the oxytocin, which causes cramping of the uterus. And you might notice some big gushes of discharge too when you're nursing. Completely normal. The discharge that you have after birth is called lochia. It is blood, it's material from the uterus, and it's common to have this discharge for up to 6 weeks after you've delivered. If you have a C-section, you'll probably have a lot less because they really get in there and kind of clean out the uterus while they're in there during the surgery. At first, it's bright red. That usually lasts, up to 4 to 5 days. Could be less, could be more. Sometimes you'll pass some clots, as long as we always used to say, and when I worked in labor and delivery, nothing larger than a golf ball. Um, and if you do start passing clots, you need to sit down and take a break and see if that helps. If it doesn't, you continue to pass a lot of blood and clots, you would definitely want to go in and get checked out. It does change to like a dark brown or a light pink, and then to a pale yellow to whitish discharge after about a week and a half to 2 weeks. And like I just said, the bleeding can increase during the breastfeeding. If it increases and you're up doing a lot of activities, slow down, take it easy. Don't forget you've got that big wound on the inside that you're trying to heal. Speaking of the discharge, your menstrual cycle can return by 4 to 8 weeks postpartum, and breastfeeding can delay the return of your period, but you can still get pregnant. It is not a reliable method of birth control by any means. So it is recommended now that pregnancies be separated by at least 18 months for the most health benefits for mom. So it used to be 12 months, now it's 18 months. Anyway, pericare. So the perineum is the area of the bottom between the vagina and the anus. And it can get damaged during childbirth. It can tear, or you might be cut through an episiotomy, but that practice is really not common anymore. But you can tear forward or backwards, and they'll repair you right after birth. They'll use dissolvable stitches, so you don't have to worry about getting them taken out. But it can be really uncomfortable just from the pressure of trying to push your baby out, or the baby sitting on the perineum for a long time during labor can cause a lot of swelling and bruising. So we recommend using some ice packs, and they'll give you some of this in the hospital, but I also like to suggest you use some menstrual pads or even a baby diaper because they're made to hold fluid. Fill them up with some water and throw them in the freezer for when you get back. Those work wonderfully. Witch hazel and dermoplast spray, which is a numbing spray, can be really helpful if you have um, hemorrhoids or a wound that's healing that's itchy or stings. Keep those on hand. And again, you'll get a lot of this in the hospital. Um, Sometimes you'll need to keep the pressure off the perineum, and especially if there's a lot of swelling. So you might want to sit on a pillow or look into getting a donut pillow. And then you can always use some over-the-counter pain relievers like Motrin or Tylenol as long as doctor says it's okay. Um, Urinating can be uncomfortable. It can burn. We don't recommend just using a dry wipe. So they usually give you what we call a peri bottle, or it's like a squirt bottle. So after you use the bathroom, you would rinse the perineum with that, and then you can pat dry. Bowel movements can be very, very uncomfortable as well, especially if you've had stitches or hemorrhoids. Putting counter pressure on your perineum, if you want to use like a cool washcloth or something while during your bowel movement, can help. Um, and I don't know if it's in my next slide. Yeah. Stool softeners or high fiber diet. Make sure you're hydrated so that you don't become constipated because that can be really uncomfortable as well. Um, and don't insert anything into the vagina until you've been okayed to do that by your doctor. Breast changes, whether you're breastfeeding or not, it happens to everybody that's had a baby. A lot of women go through an engorgement period, and usually that happens around day 3 to 5. If you've had a C-section, it's really common for the engorgement to happen later, or for your milk to come in later, more towards day 5 after birth as opposed to day 3. Um, but engorgement is when your breasts become really swollen, really hard, and uncomfortable. And then the treatment really depends on if you are breastfeeding or if you're not. So if you're not breastfeeding, we can apply cold packs. Some of those diapers that we froze in the freezer will work just fine. And we don't want to stimulate any milk letdown. So we don't want to pump. We don't want to get under a warm shower because the warm hot water can stimulate milk production. And you don't want to, like I said, the supply and demand. So we don't want to demand any. So we shut the supply down. Wear a nice snug fitting bra for your comfort. You can even use cabbage leaves to take down the swelling. Yes, I did that and I loved it. um, if you are breastfeeding and you're suffering engorgement, I like this diagram here because on the bottom, engorgement isn't just milk, it's all the fluid that you've had in your body from pregnancy and labor and delivery. So you can have excess water or fluid, sorry, around your gland, around the glands in the breast milk or breast as well. It can make it really hard for your baby to latch on. If your breast is like hard as a rock, there's nothing pliable for them to put in their mouth. So if you are breastfeeding, we can pump off a little bit of that milk to make you feel comfortable and to make it be a little bit squishier. Or we can do what we call reverse pressure softening. And basically, that is taking your fingers and putting it on the top and the bottom of the areola with a nipple in between and pushing back for 30 seconds to a minute and working your way around the breast and pushing backwards to push that fluid back towards the chest wall. And it makes the front, the areola, a little bit more pliable for baby to latch onto. So during pregnancy, in your circulatory system definitely has some changes. You're holding about 50% more blood volume than you do when you're not pregnant. Um, and also all those fluids you've taken on during your labor, they have to come out. So you might notice that you wake up drenched in night sweats. It's very common and normal. And you might notice that you're urinating or peeing a lot. Again, completely normal and normal for your baby to do as well. Sometimes after birth, your abdominal muscles will be loose, and some women actually have diastasis recti, where the muscles in the front have actually become separated, and you can put your hand in between them. It's kind of crazy. But there's lots of exercises and therapies we can do to tighten them back up. Stretch marks will be there. They will fade. They won't ever go away. Um, if you had any darkened skin, like a lot of women get the line down their belly, that will likely lighten up again. And a lot of women feel that they're losing a lot of hair. Um, when you're pregnant, your hormones cause your hair to not really fall out, I guess, if that makes sense. So when you're not pregnant, your hormones fall and that hair that you've been holding on to falls out. So you're not gonna go bald. It's just getting back to its normal state. It can feel kind of scary though when you look at your drain. Different things to watch for though after you've delivered. There's still always a chance that women can develop postpartum preeclampsia, and that would be through shown by headaches that won't go away, dizziness, changes in your vision, um, a sudden increase in swelling, especially in the hands and the face, running a fever. We're watching for postpartum infections, trouble breathing, and then severe leg pain or swelling in the legs. We're watching for blood clots there. And then the vaginal bleeding or fluid leaking after pregnancy is completely normal. But if you're soaking more than a pad every hour or passing those large blood clots, we want to get that checked out and make sure you're not uh, going into a hemorrhage there. Baby blues. Almost all moms experience what we call the baby blues. It's just because we have a dramatic drop again in the hormones. And then we've just gone through this major life-changing event and we are not getting any sleep and we're expected care for ourselves and a newborn. So there's a lot going on. It's very, very common. Um, so you might find yourself crying easily, feeling overwhelmed, just being exhausted, not being confident, getting some headaches. This usually only lasts about 2 weeks and will resolve on its own. If these symptoms, though, stay longer than 2 weeks, you will want to let your doctor know, and we can do, or any care provider, and we can do a depression screening for you. Um, we used to just say postpartum depression, but really there's a whole bunch of postpartum mental health disorders that can happen: OCD, postpartum anxiety, postpartum psychosis, which is really rare, but it does happen. And you might be more at risk for something like this if you've had mental health challenges in the past, if you've had a traumatic birth, or you have a lack of support. And those, kind of build off the symptoms of the baby blues. But again, if they last more than those 2 weeks, if you're having panic attacks, if you're not eating, or if you find yourself eating too much, um, and intrusive thoughts, thought of hurting yourself or the baby, and a lot of women are like afraid to tell their provider because they don't want to get into trouble. But we now know that this is actually quite common and we have ways to treat this. And we would prefer that you tell your healthcare provider so we can get you treated. And then I just want to put this up there. There are some national hotlines that you can call if you feel like you're likely suffering from some kind of postpartum mental health disorder. There's two of them. This one is the National Maternal Mental Health Hotline. This one is specifically for postpartum or pregnant women, and that's the 1-833-TLC Mama. And then there's the Crisis Lifeline, which is just straight 988. And you can text or call both of those lines. Okay, last subject, newborn care. The basics is really a lot, isn't it? Okay, so after labor and delivery, be prepared that you're not going to think your baby's cute. Most newborns look kind of goofy. A lot of them are born with a cone-shaped head because they've had to come through the birth canal, and that generally that goes back to normal within the first 24 hours. Their skin might be kind of red and peely because, after all, they've been in fluid for the last 9 months. They might be covered in what we call vernix. It's the white, like cheesy looking stuff that's coats the baby's skin to protect it while they're in the uterine fluid. Milia are those little white spots. You can see a couple of them on that picture on the top. Red spots, rash, very common. And don't forget that the baby will have a soft spot on their head. That's because their skull is not fused yet, so that it's allowed to move and mold to get through the birth canal. And that won't heal till around, I believe it's a year of age. So you can see that and just treat that with care. In girls, you can see swelling of the vaginal area, and sometimes they may even have a discharge, some bloody discharge. That's just a result of being exposed to mom's hormones. After delivery, there's a lot of stuff that they'll do with you and your baby. In the hospital, right away, they get an eye ointment treatment and a vitamin K injection. Eye ointment is to prevent any eye infections that they may get by picking up a bacteria through the birth canal. The vitamin K injection, infants do not have any vitamin K in their system, and vitamin K helps their blood to clot. So if a baby is born through the birth canal and they have some trauma to the head, that puts them at risk of having some brain bleed. So by giving that vitamin K, we can help prevent infant strokes. Hepatitis B vaccination is also done at birth. At 24 hours, they do a newborn hearing test. It's non-invasive. It's basically just headphones, kind of. And then the newborn blood screening is done at 24 hours, and that tests for things like thyroid disorder that we would need to know about right away. And a lot of times they will circumcise an infant in the hospital if that's what you wish to do. And just a side note, you have to have a car seat to take your baby home. So if you do choose to do a circumcision, these usually take around 7 to 10 days to heal. Um, Again, this is taking the foreskin off the infant's penis, and it can get kind of raw and red looking, and that's normal. It can have a little bit of yellowish discharge, again, normal. Really important though to make sure you have a good stock of Vaseline and some gauze pads, because each diaper change you're going to want to put Vaseline, a large amount, onto your gauze pad, put that over the infant's penis, and then put the diaper on. We don't want anything getting stuck to that, because when you pull away, it can damage the area that was circumcised. They usually give babies Tylenol in the hospital, and the day that the infant is circumcised, they may be really sleepy. So if you're breastfeeding and they don't want to nurse that day, it's okay. It's expected. Umbilical cords, usually they generally remove the clamp that's on there before you leave the hospital. Sometimes they forget, but they'll have a stump of a cord for 1 to 2 weeks. If it's generally, we want to leave the cord dry and exposed to air. So when you're doing a diaper change, you can roll down the top of the diaper so it's not rubbing on the cord and irritating it. Bathing, you can do a sponge bath. And now I just read that the American Academy of Pediatrics says it is okay to do a quick submersion bath until the cord has fallen off, as long as you dry it nice and well afterwards and don't leave it like moist with a diaper over it. So I did sponge baths with my babies, and don't ever try to take the cord off. Let it fall off on its own. And we don't use alcohol to dry it off anymore. That was old practice. It's going to look kind of dark and scabby. When it falls off, you might notice a little bit of blood, and that's normal. It's not normal though if it starts to get red and swollen, or if it oozes a discharge or pus. And if the cord is still there by 3 weeks, you would want to let the baby's doctor know for sure. Safe sleep, super important. Um, the leading cause of death for infants between 1 month and 1 year is SIDS, or sudden unexpected infant death. A lot of this includes sleep related deaths. So the current recommendation is the baby should be alone in the crib on their back. You can see there's absolutely nothing in this crib. The mattress should be nice and firm. You can keep them in the same room with you. In fact, we recommend they are in the room with you, just not in your bed. We recommend a sleep sack or a swaddle. No blankets, no stuffed animals. Crib bumpers are now actually illegal to be sold in the United States. And they should never be in an inclined sleeper like a swing or a car seat. If they fall asleep in a car seat in a car, that's fine, but we don't recommend that you put them in a car seat to sleep at night. We do actually recommend the use of a pacifier. This has been shown to decrease SIDS as well. Don't smoke near the baby. If you do smoke, please go outside, and then make sure you wash your hands before you handle the baby. And Obviously, no drugs and alcohol that can impair your judgment when putting your baby to sleep. Bathing, I touched on this a little before, but you don't need to bathe your baby every day. Um, like I said, sponge baths was recommended, and now they say the submersion is actually okay as long as it's quick. Get everything ready before you bathe your baby, though, because you can't leave your baby in the bath to go get something. Use nice warm water, but always feel the water before you put your baby in there. Never use running water on a baby because you don't know if the temperature may change. You can just do water baths, or if you do use a soap, make sure it is made specifically for babies. And always start from the top and work your way down to the diaper area. Wash their hair last so they're not sitting there with a cold head. That's where they lose the most heat. So, doing their head last and getting it nice and dry quickly will help them to maintain their body temperature. For the first 6 months, your baby should only get their nutrition through either infant formula or breast milk, or a combination of both. They do not need water. Um, their breast milk or formula will provide all the hydration they need. And we do not recommend adding cereal to your baby's bottle. Um, it's not really babies aren't really ready to digest any cereal at that point, and it can actually lead to overfeeding because they're getting more calories than the physical amount they're taking, if that makes sense. So in the end, obesity is a risk factor from that as well. They can also risk inhaling those solids into their lungs, um, and that can lead to some pneumonia. Formula preparation, always mix it according to the package, never under dilute it or over dilute it. I use always measure the formula first and then add your water. And then, sorry, I think you measure the water first, then add your formula. I said it backwards. And then never microwave it. You can run it under warm water or put it in a nice bowl of warm water to heat it up. If you don't use the formula in the bottle, if you don't feed the whole bottle, that needs to get discarded within 2 hours. Breastfed babies will feed on demand at least 8 times per day, most likely a lot more. And they should be waking up at night to eat, and so should formula fed babies. Formula fed babies should be fed at least every 2 to 3 hours. Their tummies are so tiny they can't hold as much, so they need to feed frequently. How many times do you get up in the middle of the night to eat? Um, you can burp both breastfed and formula fed babies. Um, with a breastfed baby, you'll want to burp in between each breast, and then with a formula fed baby, maybe start out with every half ounce or so. Spit up is completely normal. There is a difference between spit up and vomiting. Vomiting is a lot more forceful. It's going to shoot out rather than just kind of dribble out the mouth like a spit up does. Babies' muscles that it's supposed to say weak. Sphincter muscles, which is where your stomach meets your esophagus, is really weak. So holding down that fluid can be a little hard, especially if they're bouncing around. And so it's pretty common for that to come back up. If they're vomiting and they're, very uncomfortable and they're just, fussy all the time, that might be something to talk to the doctor about. They might have a little bit of reflux going on. If they're gaining weight and not fussy too much, then it's probably just normal spit up. Back to the sleep stuff, they don't have a regular sleep cycle, and they won't for quite a while, and I'm talking months. Please don't expect your infant to sleep through the night. That's really not a good thing if they do. They do sleep a lot, 16 to 17 hours per day, but it's only 1 to 2 hours at a time. I love this diagram. This shows like a 24-hour clock and a normal sleep-wake cycle for a newborn. Tummy time. You can start doing tummy time with your infant as soon as you get home from the hospital. And this doesn't mean you have to put them on the floor with all their toys. You can just take your baby and put them on your tummy right on your lap. And just for 2 to 3 minutes, we want to start strengthening the muscles in the neck, chest, and back that will help them to hold their head up. It will help them to roll, help them to crawl. This also helps to prevent the plagiocephaly or flat heads. You see a lot of kids in helmets, but because we put babies flat on their heads now and we don't have them sleep on their tummy, it can mold those heads to be a little bit flatter on the back. So this tummy time can help prevent that. And always, always supervise your baby when you're doing tummy time. Babies cry. Um, Sometimes we don't know why they cry, but they can cry because they're hungry. They can cry because they're too hot or too cold. I always say to dress your baby like how you are dressed. If you're hot, your baby might be hot too. Um, they might be upset because they have a wet or dirty diaper. Um, they might be upset because they're having some reflux, like we talked about earlier, or maybe they're just not feeling well. They could be overstimulated sometimes, or they might even be bored. So, different ways to calm a baby, especially if they're overstimulated, is just kind of holding them or rocking them. You can swaddle them. Um, Doing some infant massage or just, rubbing their back. Sounds, I know my son always loved it when he would calm down if I went and stood by the dryer or the washing machine. Sometimes mommies run the vacuum and that helps to calm the baby down as well. I know I still have to sleep with a fan on. You can do a warm bath. Try to take down some of those stimulants like the lights, the noise, and just see if that helps. If you get frustrated, you can always put your baby down in a safe place like the crib, pack and play, and you can walk away. Your baby is safe in there. Take a minute and get yourself calmed down to where you're able to come back and deal with it. Um, you can put on headphones or take a shower and have someone else watch the baby. You can try to, it helps to kind of drown out the noise of the crying. Um, don't be afraid to call a friend or a family member to ask for help. Most people are absolutely willing to give you a hand. And don't forget to breathe and don't pick up your baby again until you feel like you're in control. But always remember it, put your baby down in a crib and they're safe there. Most importantly, take the time to enjoy your baby and take the time to take care of yourself. I always tell my mamas, your main job is to hold and feed the baby for the next couple of weeks. And a lot of people want to come over and help, and that's great. But what we want them to do is maybe help by preparing a meal or help by changing your bed sheets or folding a load of laundry. We don't really need them to give a bottle if we are breastfeeding. So just keep that in mind. And those are just a list of my sources I used. And that concludes today's presentation. Thank you so much.
Thank you, Megan, for that wonderful presentation. I'm going to take a few minutes to go through the questions that were submitted. First question is, what are some of the breastfeeding resources that I can find in Sanilac County?
So the health department has a lot, but we have a breastfeeding support group on Facebook that you can join. And then we also have a breastfeeding support group that meets monthly called Breast Friends. That's run by the peer counselor through our WIC program, and they meet in Sandusky at the, I think it's the ISD building. It's on Jackson Street, and they usually meet, and it coincides with the baby pantry hours too. We also have lactation specialists on staff at the health department, so they can meet with a peer counselor. She can do one-on-one evaluations to see what you might to see if you need help with her or if she needs to refer you up to someone like a lactation specialist. We also have an IBCLC or a board certified lactation specialist on staff that we can refer you to. And the peer counselor actually has a 24-hour, it's not 24-hour, but an after hours warm line that you can text or call if you're in need of help at odd hours. And then I know that Sanilac County has quite a few, I believe, doulas that offer breastfeeding support as well.
Thank you for that. And then the next question is, when do you recommend integrating pumping?
So I always tell moms to just focus on nursing at the breast at first. And once we get our milk supply established, and you're not engorged and we are making sure the baby's gaining weight, then we can worry about pumping. So, honestly, if mom's not going to go back to work until week 12, I probably wouldn't start pumping until around 11 weeks. Unless they really want to start making the stash, then we can start pumping when that milk supply is established, maybe around 3 weeks or so.
Okay, and then last question is, why is the hepatitis B vaccine recommended at birth?
So they give that one at birth because babies can pick up the hepatitis B virus during delivery because of all the fluids and blood transmission there. So by giving that right at birth, it can help prevent the baby from getting hepatitis B and spreading that and unknowingly. Because a lot of moms with hepatitis B are not aware that they have it.
Thank you for that, Megan. And that wraps up all of our questions. I do want to let everyone know that the next meeting is on March 19th. The topic is Start Moving, Exercises Everywhere. And this is offered in person and virtual. And with that, it wraps up our presentation for the day.